Hi, I am Aurel Enriquez, and this presentation contains our discussion for our week 4 topic. So for this one, we would be going through the causative agents of subcutaneous and systemic mycosis. There are 4 different forms of subcutaneous mycosis. So there would be chromoblastomycosis, eumycotic mycetoma, subcutaneous phaeohyphomycosis, and sporotrichosis. So the flow of our discussion will start off by describing one of these types of subcutaneous mycosis. So example po, unahin muna natin, what is chromoblastomycosis? And then after that, we'll discuss its causative agents, and then we'll move on to the next type of subcutaneous mycosis, and so on. Subcutaneous mycoses are usually the result of traumatic implantation of objects into the skin, permitting the fungal pathogens to enter or gain entry into the host. So kung saan po nasugat or maaari din pong may gasgas sa balat or open wound yung pasyente, then dun po yung magiging point of entry ng fungal pathogens na to. Alright, let's repeat the possible modes of entry, or the usual modes of entry for acquiring subcutaneous mycosis is through traumatic puncture or occupational exposure, or if a person has an open wound. Okay, so the causative agents that are responsible for these types of infections are usually found in the soil, or on decaying vegetation, or from outdoor sources, right? Which is why most subcutaneous mycosis are related to occupational exposure, especially for agricultural workers, okay? So halimbawa po yung mga gardeners, farmers, okay? O kaya yung mga lumberjacks, yung mga nagpuputol ng puno sa mga bundok. So ayun po. So they are the population who are at most risk for acquiring these types of fungal infections. Now, these subcutaneous mycosis would involve the deeper layers of the skin, and this may progress to the patient's connective tissues and also hanggang sa muscles and bones. So these infections are more severe and more disfiguring to the patients. Okay, so more likely na this would lead to tissue scar formation, and the development is also chronic, so it's going to take months or years for the fungi to grow within the tissues and cause damage. Let's begin with the first type of subcutaneous mycosis that we would be talking about, and that is chromoblastomycosis. Now, chromoblastomycosis is otherwise known as verrucous dermatitis or chromomycosis. Okay, ulitin po natin ang chromoblastomycosis. In some references, this is otherwise referred to, or this may also be referred to as verrucous dermatitis or chromomycosis. So all of these three terms refer to the same type of infection. Okay, so as we can see right here, this is a chronic mycosis of the skin and subcutaneous membrane. So again, this is chronic, meaning it would usually take months or years for the infections and clinical manifestations to develop. Now, lesions frequently appear as ulcerated, crusty, and cauliflower-like, as we can see right here in these examples. Okay, so yun po yung characteristic description ng chromoblastomycosis. They have a cauliflower-like appearance on the outside. Now, if we were to take tissue samples from these lesions, okay, upon tissue examination, we may be able to observe brown, round sclerotic bodies. Okay, so these sclerotic bodies may also be referred to as medlar bodies, sclerotic cells, or copper penny bodies. Okay, so kapag kumuha tayo ng tissue sample dito, ito yung pwede nating ma-observe. So the presence of these copper penny bodies or sclerotic bodies is diagnostic for the disease. Kapag nakakita po tayo ng ganyan, sigurado na that the patient is suffering from chromoblastomycosis. Okay, so ayun po, if we were to make a correlation between the cauliflower lesions on the patient's skin plus history of traumatic puncture or occupational exposure, plus the presence of these sclerotic bodies upon tissue examination, then ayun po, no, we could put all of those things together, and most likely we could come up with the diagnosis of chromoblastomycosis. So listed here are the causative agents of chromoblastomycosis. First organisms on our list would be the Fonsacea species. So for Fonsacea pedrosoi, these ones would have primary conidia that function as conidiogenous cells to form a secondary one-celled conidia. Anong ibig sabihin po nito? Sinasabi na dito po, no, naka-attach dun sa, kumbaga parang conidiophore ng organism, kung halimbawa ito po, no, as you can see from the pointer, kung ito yung hyphae, and then the structure right here is the conidiophore, no, sinasabi po na the conidia forming cell, it usually just starts as one primary conidia. Okay, so mag-isa niya lang muna na nag-grow dito out of the conidiophore, and then eventually it would create secondary one-celled conidia. So itong isang cell na to, it creates one conidia, and then yun yung tatawagin na secondary conidia, and so on. So, sinasabi lang na magsisimula dito yung growth ng bawat isang conidia. So, this thing right here, these ones right here are referred to as the primary conidia. The structure that's directly attached to the conidiophore, which is this elongated structure right here. And then yung conidiophore is directly connected onto the hyphae. Okay? So, ayun po, no? For Fonsacea, Fonsacea compactum, now, this one is almost indistinguishable from Fonsacea pedrosoi, okay? So, its only difference is that its conidial heads are more compact, hence the name, okay? So, magkamukha daw po ang Fonsacea pedrosoi and Fonsacea compactum. It's just that mas mukha daw magkakadikit yung conidia ng Fonsacea compactum. So, ayun po, medyo mahirap ma-distinguish yung difference. Okay? So, kumbaga is parang sa descriptions na lang tayo magbe-base, which is, yun nga, the conidial heads are more compact or closer to one another. Itong mga susunod na organisms po, no, magfo-focus na tayo dun sa characteristic descriptions nila. Okay? So, lahat naman po kasi ng ito ay causative agents ng chromoblastomycosis. So, titignan lang natin ano yung characteristic description, ano yung special description that specifically describes each of these organisms. Next is Fialophora verrucosa. So, the characteristic microscopic appearance of Fialophora verrucosa would show us its flask-shaped phyalides, which are seen right here. Okay, flask-shaped phyalides. Mukha daw flask or parang manipis na flower vase. And then, the conidia would be formed from these conidiogenous cells that are typically arranged in collarets, as we can see right here in this example. So, kapag sinabing collarets, no, nakaipon siya sa taas, tas medyo mukhang parang flower-like yung arrangement niya. Okay, so ulitin po natin, no, flask-shaped phyalides plus arrangement of conidia in collarets equals Fialophora verrucosa. Okay, so ayun po, no, medyo fit yung description, no? Kasi may flower vase sa ilalim, tapos may flowers sa itaas, as we can see right here. So, phyalides and conidia in collarets. Next causative agent of chromoblastomycosis is Cladofialophora carionii. So as shown here, in this picture, it has erect conidiophores. Okay, so may isang diretsong conidiophore lang daw po siya. And then, it's holding long branch chains of one-celled blastoconidia. Okay, so pag sinabi nating branched chains, as we can see right here, ganito po yung itsura nila. Now, anong meaning ng branch chains of one-celled blastoconidia? Pag sinabi nating branch chains, ayan po, no, nakikita naman natin, may parang branches siya or parang may mga magkakaibang directions tayong nakikita. Pero pag sinabi natin na one-celled, no, obviously, we're not just seeing one cell right here, pero dito po, ang nakikita natin is one cell is only connected to the next cell. So, yung isang cell, isa din lang yung cell na nakaduktong sa kanya except for the area kung nasaan yung branches. Okay? So, tignan po natin itong example na to. This cell is connected only to this one. 'Di ba? Maliban na lang dito sa area of branching. Next, itong cell na to is connected only to this one. So, tigwa one cell lang yung connections nila except for the areas kung nasaan yung branches. So, yun yung meaning when we say one-celled pero branched chains of conidia. Okay? So, tig-iisang cell lang yung nakaduktong sa bawat isa, maliban na lang dun sa point of branching, as we can see right here. All right, next causative agent of chromoblastomycosis is Rhinocladiella aquaspersa. So Rhinocladiella aquaspersa would have straight conidiophores, no, straight and erect conidiophores, as we can see right here. So, katulad nung previous one, isang diretso lang din daw po yung conidiophore niya. Ang pinagkaiba lang nito is that mas maigsi, no, mas maigsi yung itsura nung conidiophores niya. Aside from that, no, it also has conidia that is attached only at the upper portion near the tip, as we can see right here. So, dito po, no, nakakonsentrate sa itaas lang daw po, no? Sa itaas lang natin makikita yung mga conidia niya. Okay? So, isang diretso pero maigsi na conidiophore plus yung conidia nasa top portion or near the tip lang. Another notable thing about Rhinocladiella aquaspersa is that it has elliptic-shaped conidia, as we can see right here. Yung mga previous conidia na nakita natin, they're a bit more round or spherical in appearance, diba? Pero pag sinabi nating elliptic, medyo pahaba. Yung itsura niya, they're almost kind of like shaped like rice grains. Okay, so parang ganun daw po yung itsura. No, parang ganun po yung itsura ng conidia na pinoproduce ng Rhinocladiella aquaspersa. So again, no, kapag pinagsama-sama natin yung mga descriptions na ito ay causative agent ng chromoblastomycosis, its conidiophores are straight, short, but erect. Tapos, yung conidia na is nasa upper portion lang sa bandang dulo, near the tip. Tapos, elliptic yung shape nung conidia, then ayun po, dapat ang maiisip na natin is Rhinocladiella aquaspersa. Alright, so that was for the causative agents of chromoblastomycosis. Let's now proceed to the causative agents of eumycotic mycetoma. But before we get into that, of course, describe muna natin, alamin muna natin, no, what is eumycotic mycetoma. So these ones, no, the term mycetoma, yung mismong word lang na mycetoma, this can be caused by either fungi, no, or bacteria. Okay? So, kung ito ay dinudulot ng fungi, tatawagin natin siyang eumycotic mycetoma. Pero kung yung mycetoma po ay dinulot ng isang bacteria, then we would refer to this as an actinomycotic mycetoma. Okay? Parehas po kasi yung clinical manifestations, no? Parehas yung appearance ng lesions. Pero magkaiba kasi yung causative agents, which is very important in terms of diagnosis. Mahalaga rin naman po, no, na kahit parehas yung clinical manifestations, mahalagang malaman pa rin natin kung bacteria or fungi ba yung causative agent, because this would also affect the clinical management or yung treatment na ibibigay sa patient. Kasi diba, iba yung drugs used for antibacterials, iba yung drugs used for antifungals. Okay, so ulitin lang po natin, no, yung terminologies. When we say that a mycetoma is caused by a fungi, then it is referred to as a eumycotic mycetoma. Pero kapag ang mycetoma ay dinulot ng isang bacteria, then it is an actinomycotic mycetoma. Okay? So for this discussion, ang focus po natin is eumycotic mycetoma. Alright, so eumycotic mycetomas are characterized by swelling, exudate draining, and eventually tissue destruction, as we can see right here in this figure 3. Okay, ulitin natin, swelling, so namamaga daw yung infected area. Exudate draining, meaning may tissue fluids and pus that is coming out of the infected area. And ayun nga po, no, there is tissue destruction, as we can see right here. So this would definitely leave a scar, no? Kung saan man siya, or kung saan man yung affected site, this would definitely leave the patient to be disconfigured, or kumbaga is pag nag-heal yung open wound, hindi na parehas yung itsura ng skin doon. Okay? So, ayan. The direct microscopic examination of the granules that would be collected from the draining lesion should reveal hyphal elements from any of the following causative agents. Okay, ulitin natin. Dito daw tayo pwedeng kumuha, no, ng sample. So, we would take fluids from the draining areas, and then we should be able to observe granules and some hyphal elements, no, and other fungal cells from these causative agents. Okay, so listed here are the different causative agents of eumycotic mycetoma. So magkakaibang causative agents pero parehas po yung clinical manifestations. There is swelling, exudate draining, tissue destruction. And microscopically, there are granules and hyphal elements from the fluids. Okay, so the first causative agent of eumycotic mycetoma on our list is Pseudosporium boydii or Pseudoaliscaria boydii, depending on which form we're looking at. Okay, so upon microscopic morphology, no, if we're observing the anamorphic form, meaning the asexually reproducing structure of this organism, natatawagin natin siyang Pseudosporium boydii. Okay, so the Pseudosporium boydii would appear to be like oval-shaped conidia near or at the tips of annelids. Okay, ulitin po natin, kapag anamorph form yung tinitignan natin, ang tawag doon ay Pseudosporium boydii. Okay, and ang itsura niya, ganito po, oval-shaped conidia na nasa pinakadulo ng mga annelids. Now, this organism also has a teleomorph form, and the teleomorph form would be referred to as the Pseudoaliscaria boydii. So, yung Pseudoaliscaria boydii naman po, it produces what is known as a cleistothesia, which contains spores. Let's look at this photo right here. Okay, so this is basically an ascospore, di ba po? So if you would remember for our past discussion on week 2 topics where we talked about the taxonomic classifications of fungi, yung Mucorales, Ascomycota, Basidiomycota, and Deuteromycota, di ba na-enumerate natin doon? Nakasama yung Pseudoaliscaria boydii. And yun nga po, no, it's basically an ascus containing ascospores. Pero yun nga po, magkakaibang organisms kasi magkakaiba yung tawag. So specifically for Pseudoaliscaria boydii, yung ascus niya, ang tawag ay cleistothesia. Okay? Pero ayun nga po, no, as with all other members of Ascomycota, the general structure is the same. Okay? So container sa labas, spores sa loob. Okay, so ayun nga po, specifically dahil ang pinag-uusapan natin ay Pseudoaliscaria boydii, its ascus would be referred to as a cleistothesia. Again, this is the teleomorph form. Still on the causative agents of eumycotic mycetoma, we have what is known as Fusarium falciforme. Okay, now Fusarium falciforme is formerly known as Acrimonium falciforme. So maaari po na sa mga lumang editions, no, maybe like at the 4th or 5th edition of Mahon, ang tawag pa dito ay Acrimonium falciforme. But in newer references, this is now referred to as a Fusarium falciforme. So this is still a causative agent of eumycotic mycetoma, and this is what it looks like upon microscopic examination. Okay, so let's look at the characteristic descriptions. First up is that it has a slightly curved conidia, as we can see right here. Now, looking at its appearance, remember that one other organism na natutunan natin sa Micro 1 bacteriology? Remember the cells of Vibrio cholerae and other Vibrio species? Parang ganun yung itsura niya, di ba? Parang bacilli shape tapos slightly curved. Ganun daw po yung itsura ng conidia ng Fusarium falciforme. Okay, so it's slightly elongated or kind of like bacilli in shape, and then it's a bit curved. All right. Next, we may be able to find this at the tips of long unbranched and multiseptated conidiophores, as we can see right here. So, sobrang haba daw po ng conidiophores ng Fusarium falciforme. Up next, still on the causative agents of eumycotic mycetoma, we have Majorella mycetomatis and Trimatosferia griseia. Ulitin po natin yon. Majorella mycetomatis and Trimatosferia griseia. Okay, so these ones, they both look the same, both in their macroscopic and microscopic morphology, as we can see right here in this photo to the left. Okay? Ulitin natin, sobrang magkamukha daw po ang Majorella mycetomatis and ang Trimatosferia griseia. So, paano natin sila ma-differentiate? We would have to look at their optimum growth temperature. Okay? So, depending on their optimum growth temperature, then doon natin malalaman which one is which. Okay? So, first up is Majorella mycetomatis with a growth temperature or optimum growth temperature at 37 degrees Celsius. So, kung halimbawa, no, in-isolate natin to organism na to, tapos ginrow natin sa 37 degrees Celsius, tas doon mas marami or mas abundant yung growth niya, tas pag pinalitan natin yung growth temperature, tapos medyo mas kaunti, no, hindi ganun ka-abundant yung growth niya, then it's probably Majorella mycetomatis. Ngayon, kung babalik rin natin yung scenario, no, if for example, i-grow natin siya sa 37 degrees Celsius, tapos minimal or halos walang growth, pero pag binaba natin papunta ng 30 degrees Celsius yung temperature, tas dun dumami or naging abundant yung growth ng organism, then it's Trimatosferia griseia. Okay? Ulitin natin, if the optimum growth temperature, or if we were able to observe more growth or better growth at 37 degrees Celsius, tapos ganito yung itsura, then it's Majorella mycetomatis. Pero kung halimbawa, your eumycotic mycetoma patient, no, nakuha kayo ng sample, tapos you grew the samples at 37 degrees Celsius, pero walang nangyari, or wala masyado kayong na-observe, pero later on, binaba niyo yung growth temperature papuntang 30 degrees Celsius, tas dun naging abundant yung growth, then it's Trimatosferia griseia. Okay? Now, ayan po, they're seen right here together, or they are discussed together kasi po, ang Trimatosferia griseia was formerly referred to as Majorella griseia. Andito pa rin po tayo sa mga causative agents ng eumycotic mycetoma. Up next is Exophiala gensulme. I can't help but laugh every time I read this like species name because I have friends out there that they keep saying gusto nilang pangalanan yung anak nila ng gensulme. I mean, okay, it sounds nice. It sounds pretty. Okay, it's just that kapag tinanong nung anak nila kung saan galing yung pangalan nila, it's going to be a bit difficult to explain. But anyway, for Exophiala gensulme, again, this is also a causative agent of eumycotic mycetoma. Now, with regards to its microscopic morphology, it produces annelids with conidia aggregating in masses at the tips of the conidiophore, as we can see right here. So basically, kung halimbawa ito yung conidiophore, usually makikita po natin na nakagather sa pinakadulo yung mga conidia niya. Another thing that we may be able to notice is that in comparison to the conidia of the other organisms that we talked about earlier, the conidia of these ones are a bit thicker, mas makapal yung itsura ng mga conidia ng Exophiala gensulme compared to the others. Yung iba, ang shape nila more round, more spherical, no? Yung isa, yung Rhinocladiella aquaspersa, elliptic yung shape ng conidia niya. But these ones, they're kind of like much more, not elongated, it's a bit longer, no, compared to a usual round shape, but not exactly elongated like Rhinocladiella aquaspersa. But there's a difference, na, diba? If titignan niyo yung mga previous pictures ng ibang organisms kanina, there's an obvious difference. And yun nga, they're a bit thicker. They look like tiny sausages. Okay, so parang ganun daw po yung hugis ng Exophiala gensulme. So, ayan po. Figure A and B, this is what it looks like, no, on the affected areas at the foot of a patient. And then figure C and D, yan po yung pwede nating makita if we were to take samples for tissue examination. Let's now talk about subcutaneous phaeohyphomycosis. Okay, so this one is a type of fungal infection that is caused by darkly pigmented fungi. Now, if you would remember our discussion from the week 2 topics, diba? Darkly pigmented fungi are those type of fungi with high amounts of melanin within their cells, and they are otherwise referred to as demaciaceous fungi or phaeoid fungi, di ba po? Kaya phaeohyphomycosis dahil dinudulot ito ng mga phaeoid fungi. Okay, and of course, another term for phaeoid fungi is demaciaceous. Okay, so these fungi would form yeast-like cells in tissue, as we can see right here in this example. So, kung halimbawa, ito po yung lesions, no, na magfo-form underneath the skin of the patient, kapag kumuha tayo ng tissue biopsy samples from that one, ito yung mga pwede nating makita. But if we were to grow the organisms on artificial culture media, this is some of the examples that we may be able to observe. But anyway, magkakaibang causative agents, magkakaiba rin po yung pwedeng ma-observe natin na appearances. So listed here are the possible causative agents or some of the most well-known causative agents of phaeohyphomycosis. Okay, so we have Alternaria bipolaris and Curvularia, and also some Exophiala species like Exophiala dermatitidis and Jeansalme. Okay, so for this one, no, it's quite easy to remember kasi nakaayos sila in alphabetical order. Wala lang letter D, di ba? Pero we have A, B, C, and E. Alright? Alternaria bipolaris curvularia and Exophiala. Okay? So kapag tinanong kayo, no, which of the following is not a causative agent of subcutaneous phaeohyphomycosis, no? Kailangan yung isipin, apat lang naman yung nasa listahan natin ng possible causative agents or well-known causative agents ng subcutaneous phaeohyphomycosis, di ba? Alternaria bipolaris curvularia and Exophiala. Okay, so sa lahat ng mga organisms na na-discuss natin kanina, kapag sinabing subcutaneous phaeohyphomycosis, dapat ma-narrow down nyo na dito sa apat na ito yung maiisip nyo ng mga organisms. Okay? So, yun po. Tingnan natin yung microscopic appearances nila for each one of these. Before we actually begin, just a side note, if you've already read your Mahon 7th edition in advance, makikita nyo po doon na hindi agad-agad nakalista yung Alternaria bipolaris and Curvularia and yung mga descriptions nila under the discussion of subcutaneous phaeohyphomycosis. Ang Alternaria bipolaris and Curvularia, mapag-uusapan pa sila pagdating pa lang doon sa usapan or doon sa parang topics or discussion with regards to opportunistic mycoses. Okay, so nilipat ko lang po sila dito sa discussion ng phaeohyphomycosis because one, sila nga yung most well-known causative agents of subcutaneous phaeohyphomycosis, and two, medyo masyado na tayong maraming madidiscuss na organisms pagdating natin sa usapan ng opportunistic mycosis. So para lang mabawasan yon, itong tatlong well-known causative agents ng phaeohyphomycosis ay nilipat ko na po dito. Okay? So again, to understand the difference or to get a context of what I'm talking about, make sure that you read your copies of Mahon 7th edition. Alright? So let's now talk about Alternaria species. Let's focus on its microscopic morphology. Okay? So the microscopic examination would reveal conidia in chains. Okay? Usually, like what we're seeing right here, in chains, so magkakaduktong daw po yung conidia ng Alternaria species. Aside from that, they've been described to be muriform and tapered. Alright? Muriform and tapered. Anong ibig sabihin ng mga descriptions na to? Unahin natin yung word na muriform. So when we say muriform, it means that they have both horizontal and vertical no, septations, horizontal and vertical septations, as we can see right here. So, sinasabi po na may parang divisions or hati siya at different directions. Okay? If you would remember our discussion on the cutaneous mycoses, di ba? Nakikita natin yung macroconidia ng Nanedzea gypsea, tsaka yung Microsporum canis na isa lang yung direction nung septations nung bawat macroconidia, di ba? Pero dito daw po for alternaria species, pwedeng magkakontra or magkaiba yung direction nung septations. Next description that was used here is that it is tapered, no? Especially at one end. So, pag sinabing tapered at one end, it's slightly more pointed or patulis daw po yung isang dulo nung bawat cell. Okay, as we can see right here. So again, when we say muriform, magkaiba yung directions nung septations niya. And when we say tapered, one end is slightly sharper in comparison to the other end. Alright, so kapag nakita natin yung dalawang descriptions na yan, we're talking about the alternaria species. Next is bipolaris species. All right, so next causative agent or well-known causative agent of phaeohyphomycosis is the bipolaris species. Now, this one, out of the three, no, ito yung pinaka hindi masyadong special, wala masyadong kakaiba, no, wala masyadong unique sa description ng conidia niya. So, it's only been described that it has conidiophores with multi-celled oblong or cylindrical conidia. Okay, so these examples right here show us that they've been stained with lactophenol cotton blue. Okay, so yung color blue na nakikita natin dito, no, that's brought about by staining or preparation with lactophenol cotton blue. Pero ulitin natin, these are causative agents of phaeohyphomycosis, meaning sila ay mga phaeoid fungi. So as we can see right here, no, yung brown color is still like very obvious. All right. Now, if you notice, no, nabanggit natin kanina, diba, most of the causative agents of subcutaneous mycosis are usually found in soil, decaying vegetation, outdoor environments, no. So if may makikita kayong mga plants or leaves na ganito yung itsura, no, most likely this is some form of infection on plants caused by the bipolaris species. Now, that's what it looks like if it's infecting a plant. Kasi nga po, di ba, more likely we may be able to isolate these organisms, no, from outside environments, from the soil. So mas madalas nating ma-observe yung presensya, no, or yung infections ng bipolaris species on leaves or plants. Let's now talk about the Curvularia species. Now, Curvularia is found worldwide and is frequently recovered in grass, leaves, or decaying vegetation. All right, so this genus is one of the easiest one to identify because of its crescent-shaped conidia and conidiophores that are twisted at the point of attachment. Okay, so sa lahat ng mga diniscuss natin, no, na causative agents ng phaeohyphomycosis, I think for me, this is the one that's easiest to remember, pinakamadaling tandaan, no, pinaka-obvious yung description niya, no, pinaka-kaya mong i-correlate yung pangalan niya sa description niya. Alright, first up, no, it has a crescent-shaped conidia, as we can see right here in these examples. Lalo na yung mga more mature conidia, mas curved pa yung itsura nila. Okay? So, some of these photos kind of like remind me of croissants. They kind of look like croissants. Or am I just hungry? Anyway, aside from that, no, tignan natin, it also has conidiophores that are twisted at the point of attachment, as we can see right here. So, kung saan daw po may nakadikit na conidia, meron din daw pong curve or bend yung conidiophore. Okay, so ayun po, no, ang daling tandaan kasi nasa pangalan na niya yung description niya. Halos lahat ng structures na meron ito, meron siyang curve, di ba? Yung conidiophores niya may twist or may curve kung saan may nakadikit na conidia. Yung mismong conidia niya naka-curve din or crescent shape yung description. So that was for the Curvularia species. Let's now proceed to the next form of subcutaneous mycosis, which is sporotrichosis. All right, so the causative agent of sporotrichosis is the members of the Sporothrix schenkii species complex. Okay, so nabanggit po dito, no, yung word na complex. So in the past, all right, in the past, they thought na iisang species lang ang nagdudulot ng sporotrichosis, and it was Sporothrix schenkii. But further studies were done, and they were able to find out na ito pala ay dinudulot ng multiple different species with great similarities. Okay, so they were grouped together, no, these different species, they were grouped together into the Sporothrix schenkii complex. Right, so yun po yung ibig sabihin when we say complex. Right? Now, the mode of transmission for this one is acquired through gardening, specifically exposure to rose thorns. Diba, roses, they have thorns or yung mga tinik sa gilid. No? So, if you accidentally get pricked or matutusok kayo ng mga tinik na yon, tapos, ayun nga, merong spores ng organism or cells ng organism na to, doon sa rose thorns, you may be able to acquire the infection, and this may also be acquired through the handling of sphagnum moss. Okay? Ano ba yung sphagnum moss? Now, if you are or if you've seen other content creators na yung content nila is about taking care of exotic animals, no, people who take care of tarantulas, no, centipedes, other insects, no, that they take in as pets, no. Usually yung enclosure nila, they add some plants and other types of decorations and other stuff within those enclosure, and kasama po doon yung sphagnum moss. Okay, so sinasabi po na we may be able to acquire, no, sporotrichosis from handling sphagnum moss. Okay, so this disease is otherwise referred to, no, sporotrichosis is otherwise referred to as the rose handler's disease. Kasi ayun nga po, no, very common to acquire the infection if you are a gardener taking care of roses. Right? So let's look into the clinical manifestations. Now, there are two most common forms of sporotrichosis, and first up is lymphocutaneous sporotrichosis. Okay, out of all the forms that have been listed here, yung lymphocutaneous sporotrichosis talaga yung most commonly observed. Okay, it is most likely that an infection with sporotrichosis would lead to lymphocutaneous. Okay, so these ones would produce nodular ulcerative lesions along the lymph channels, as we can see right here in figures C and D. Okay? So kapag sinabing lymphocutaneous, kapag sinabing they're following the lymph channels, no? If you look at these photos right here, kung halimbawa, let's look at figure C. Kung halimbawa ang point of entry ng organism ay dito sa thumb ng pasyente, as the disease would develop, no, as sporotrichosis would develop, yung lesions, hindi siya mag-stay lang dito sa thumb. It would spread mula dito until the up to the other part of the arm, no? Kung nasaan yung lymph nodes niya or yung lymph vessels niya or lymph channels, as we can see right here. Okay? So, tuloy-tuloy yung spread ng organism, and susundan niya yung route or yung daanan kung nasaan yung lymph vessels or lymph channels ng pasyente. Kaya po ganito yung itsura. Dito sa figure D, ganun din po, no? If, for example, ang point of entry is here at the top of the hand, tapos yung lymph channels niya ay nandito, tuloy-tuloy lang po magpo-produce ng lesions, no? Mula sa point of entry upwards hanggang kung nasaan man yung mga lymph vessels or lymph channels niya. So when we see these types of lesions, then we're seeing lymphocutaneous sporotrichosis. Now, a lesser kind of like form or lesser version of this one would be the fixed cutaneous sporotrichosis. Now, as the name implies, no, it is fixed. It is confined at the point of entry. So as we can see right here on figures A and B, okay, A and B, kung saan yung point of entry, nandun lang din yung lesions, okay? Hindi siya nakapag-spread papunta dun sa lymph vessels or lymph channels ng pasyente. Right? Less common Clinical manifestations could be mucocutaneous sporotrichosis and pulmonary sporotrichosis. Pero ay nga po, ang focus natin ay nandito sa dalawa. Either lymphocutaneous sporotrichosis, sinusundan yung lymph channels, or fixed cutaneous sporotrichosis. Pag fixed cutaneous, nag-stay lang siya dun sa point of entry. Now, one important description that we need to remember about the Sporothrix-Schenckii complex is that they are dimorphic. Okay, ulitin natin ang Sporothrix-Schenckii complex. Ang mga members nito ay dimorphic fungi, meaning it has a mold phase. Now, specifically, ang itsura ng mold phase ng Sporothrix-Schenckii complex is that they are arranged in a rosette formation. Okay, so mukha daw pong flowers yung conidia ng Sporothrix-Schenckii complex kung mold phase yung tinitignan natin. Alright? But being a dimorphic fungi, meron din siyang yeast phase. Now, the yeast phase, we would be able to observe cigar-shaped cells, as we can see right here. So, cigar-shaped cells, so medyo mas pahaba, manipis, na elongated daw po yung itsura nung cells kapag yeast phase ng Sporothrix-Schenckii complex yung tinitignan natin. Now, aside from that, aside from the mold and yeast forms, if we were to proceed with tissue examination from the patient, kukuha na tayo ng tissue sample galing dun sa infected areas, we should be able to observe what are known as asteroid bodies. Okay, so asteroid bodies, this is otherwise referred to as the Splendor-Hopely phenomenon. Okay, so asteroid bodies, they are intracellular structures or radiating filamentous extensions that could be seen within polymorphonuclear cells. All right, polymorphonuclear cells or yung mga neutrophils, di ba? Okay, so ayan po, pag sinabi natin na radiating filamentous extensions, we may be able to see this structure in the middle, tas may mga extensions or parang filaments or kumbaga parang may guhit-guhit siya sa paligid niya. Okay, so kapag nakita po tayo ng mga ganito, ito yung mga asteroid bodies na pwedeng makita sa tissue samples ng mga persons with sporotrichosis. Keep in mind, do take note though, that the appearance of the Splendor-Hopely phenomenon may also be observed in other conditions. Okay, ulitin natin, although binibigyan tayo ng clue ng asteroid bodies that the infection is most likely sporotrichosis, sinasabi po dito na hindi exclusive sa sporotrichosis ang pagkakaroon ng asteroid bodies. There may be other non-infectious diseases out there that could also produce the asteroid bodies. Alright? So we have to be very careful in terms of diagnosis. Hindi porket nakita ng asteroid bodies ay sporotrichosis agad. So kailangan makapag-observe din tayo ng yeast phase or yung mga cigar-shaped cells. Kung i-grow natin yung organism on artificial culture media, dapat maka-observe muna tayo ng rosette formation of conidia. So kapag nakita na natin itong mga to, that's when we may be able to conclude na, sporotrichosis yung meron yung pasyente. Of course, i-correlate din natin doon, if may occupational exposure or traumatic puncture wound ba yung pasyente. Okay, pero ulitin natin, the appearance of asteroid bodies or the Splendor-Hopely phenomenon is not exclusive to sporotrichosis infections. Okay, so info listed here are the members of the Sporothrix-Schenckii complex. All right, let's now proceed to the next segment of our discussion. Let's now talk about the causative agents of systemic mycosis. So we have blastomyces dermatitis, histoplasma capsulatum, coccidioides immitis, paracoccidioides brasiliensis, and Talaromyces marnifae. Systemic mycosis or disseminated mycosis, these have the capability to affect the deep tissues and other internal organs. Okay, so hindi na readily observed on the outside yung mga infections na to. Hindi na tayo basta-basta makaka-observe ng skin manifestations or skin lesions, no? Ito po talagang systemic or internal organs na yung inatake ng mga organisms na to. And these ones would usually have the lungs, no? Yung lungs, yung initial site of infection for these ones. Okay, ulitin natin. Usually, the initial site of infection for systemic mycosis are the lungs, all right? And this would happen via inhalation of the fungal cells or the infective spores. And this would move through the host system hematogenously, meaning dadaan po ito sa circulatory system natin. Okay? Remember your basic anatomy. Diba? Sa basic anatomy natin, when we inhale air, no, what would happen is yung oxygen galing dun sa air na yun, mapupunta sa lungs natin, tapos mag-gas exchange sila mula dun sa alveoli natin, tapos pupunta dun sa mga RBCs na magbibitbit ng oxygen. Okay? But if, for example, a patient inhales also these pathogenic organisms, maaaring yung mga pathogenic organisms, makikigas exchange din sila papunta dun sa mga RBCs. So, yung mga RBCs na ito ngayon, no, hematogenously or through the systemic circulation, kinakalat na nila yung pathogenic organism na na-inhale ng pasyente. Okay? Now, ayan po, again, the mode of transmission for these ones would be through inhalation, and the spread happens hematogenously. Now, generally, all causative agents of systemic mycosis are dimorphic fungi. Okay, ulitin natin, lahat ng mga organisms na to ay dimorphic fungi, no? So, the microscopic morphology of their mold forms would be observed usually at 22 degrees Celsius, and then the yeast forms may be observed at 37 degrees Celsius plus in an increased carbon dioxide environment. Okay, so ulitin po natin, no, if we isolate these organisms and we grow it sa condition na nasa 22 degrees Celsius siya in an artificial culture media, then doon natin ma-observe yung mold form. Now, is it necessary na nasa loob ng tissue sample para ma-observe natin yung yeast form? Not really. Okay? It's not necessary, no, na may living human tissue sample tayo para ma-observe yung yeast form. As long as sinusunod po natin yung condition, yung growth condition at 37 degrees Celsius plus an increase in carbon dioxide, then we may be able to induce or convert the growth of the organism para ma-produce niya yung yeast forms niya. Okay? So, dimorphic fungi, diba? Nag-iiba-iba lang yung forms or appearances nila depending on growth condition. All right, temperature and growth condition. Okay, so yun po. Listed here are the usual or common clinical manifestations, which if you look at these ones right here, fever, fatigue, chronic cough, and chest pain, they're very non-specific. No, very non-specific po yung mga clinical manifestations nitong mga systemic fungal infection to. Okay, so as we go through our discussion, tignan natin yung iba pang mga descriptions per organism na pwede nating ma-observe. Blastomyces dermatitis is the causative agent of blastomycosis. Now, blastomycosis po, this is otherwise referred to as the North American blastomycosis or the Gilchrist disease or the Chicago disease. Okay, but it's the most well-known as the North American blastomycosis or causative agent of the North American blastomycosis. So listed here are its sources, no, usually acquired through occupational exposure from soil or river valleys. All right. So some individuals, no, with regards to clinical manifestations, some individuals may remain asymptomatic, lalo na kung immunocompetent naman yung pasyente. But usually primary symptoms, no, would present with flu-like symptoms. Okay, so in usual na may fever, coughing, all right. Sometimes there's also weight loss and chest pain. Okay. Now, an invasive disease may follow, resulting in ulcerative lesions on the skin and bones. Okay, so usually ito na po yung mga patients suffering from a chronic infection. Okay? Now, for immunocompromised patients, multiple organ systems may be involved and rapidly fatal. Alright? So, kung immunocompromised po yung pasyente, nakakamatay itong infection na to. Right? But again, no, for normal, healthy individuals, flu-like symptoms lang. Now, next, let's now talk about the microscopic appearance of blastomyces dermatitis. The mold form of blastomyces dermatitis are oval or globose, and they're usually growing on short conidiophores, as we can see right here in this photo. Alright, so hindi masyadong special yung itsura, no, ng mold form ng blastomyces dermatitis. We've seen other organisms from our previous discussions na medyo mukhang ganito rin, diba? So again, we're seeing oval or globose or parang pabilog na shape ng conidia on very short conidiophores. So as we can see right here, halos nakadikit na siya dun sa mismong hyphae. Now, nandito po sa yeast form, no? Nasa yeast form yung characteristic description ng blastomyces dermatitis. Its yeast form has been described as large cells with unipolar broad-based budding. Okay? Meaning there is a distinguishably wide point of attachment between the mother cell and the daughter cell. Okay? Tignan po natin itong example nito. Kapag sinabi nating unipolar, no, isang direction lang or isang area lang yung lugar kung saan pwedeng mag-grow yung daughter cell nitong organism na to. Kapag sinabi naman po natin na broad-based budding, malapad daw po yung point of attachment ng daughter cell dun sa mother cell. Okay, mamaya, i-compare natin to dun sa isa pang organism na magkabaliktad yung description. Multipolar, narrow-based budding naman. Okay, but again, for blastomyces dermatitis, no, it is unipolar, broad-based budding. Isang direction lang yung growth ng daughter cell and malapad yung point of attachment. So, this is the characteristic description of blastomyces dermatitis. Other terminologies that we need to be familiar with is that meron pong teleomorph form. Okay, merong teleomorph form or sexually reproducing form ang blastomyces dermatitis, which is referred to as agelomyces dermatitis. Okay, so i-rewind natin, no, if you would remember our discussion on Pseudosporium boydii or Pseudo-Ascaria boydii. Okay, so magkaiba rin yung tawag dun sa anamorph tsaka teleomorph, di ba? So dito rin po, no, for blastomyces dermatitis, iba rin yung tawag sa teleomorph form niya. So again, the teleomorph or sexually reproducing form of blastomyces dermatitis is referred to as agelomyces dermatitis. Listed here are other notable species capable of causing blastomycosis. So, na-isolate na rin po from clinical samples ang blastomyces helicus and blastomyces gilchristii. Let's proceed to the next causative agent of systemic mycosis, which is Coccidioides immitis. Okay, so Coccidioides immitis, this is the most virulent fungal organism known to man. Alright, ulitin natin. Yung lahat, kumpara, no, kung ikukumpara natin sa lahat ng ibang organisms na na-discuss natin from previous discussions and sa ibang mga organisms na i-discuss pa natin from in future discussions, ang Coccidioides immitis po ang pinaka-virulent. Okay? So, kakaunting cells lang po yung may inhale ng isang pasyente. This is already enough to cause an infection. Okay, so that's how virulent Coccidioides immitis is. Kahit low amounts or minimal amounts lang ng spores or cells yung ma-inhale nung pasyente, ayun po, sapat na ito to cause an infection. That's what made it so virulent. Now, other recognized species capable of causing coccidioidomycosis is Coccidioides possidacei. It's just that more common and mas kilala po ang Coccidioides immitis, pero kaya rin naman pong gawin ito ng Coccidioides possidacei. Same sources, we may be able to isolate this from soil, decaying vegetation, and other outdoor environments. And, ayan, listed here are its clinical manifestations. Okay, so as usual, primary infections would start at the lung dahil via inhalation yung mode of transmission. And again, if the patient is immunocompromised or immunosuppressed, this could proceed to a disseminated disease. Now, aside from that, this could also lead to allergic manifestations. Alright? So, maliban dun sa mismong infection, pwede rin daw pong magkaroon ng allergic reaction yung pasyente sa presensya nung coccidioides immitis within its system. So, listed here are the different allergic manifestations: desert bumps or erythema nodosum, valley fever, otherwise referred to as erythema multiforme, and desert rheumatism or arthritis. Again, hindi pa ito yung main infection, no? Allergic reactions lang po ito nung pasyente to the fungi. Now let's look at its descriptions. First up, no, it has a mold form that is barrel-shaped. So it's barrel-shaped arthroconidia with disjunctor cells, as we can see right here. Again, if you would remember our previous discussion on the week 2 topics, kapag sinabi nating arthroconidia, this is basically a hyphae that has matured, no, a septate hyphae that is matured, and then eventually, no, it fragmented or naghiwa-hiwalay or nagputol-putol siya into pieces. So, ganun daw po yung mold form ng coccidioides immitis. Its hyphae would be converted into an arthroconidia that has been described to be barrel-shaped. Now, what are disjunctor cells? Ano ang mga disjunctor cells? So, these ones, no, are the empty spaces in between each arthroconidia. So, may nakikita tayo dito na parang may mga cells, pero medyo mas clear sila or parang walang laman. Okay, so yun po yung tinatawag ng mga disjunctor cells. Next, its yeast form. No? For the yeast form, we would be able to observe spherules containing endospores. Okay, so within tissue samples daw po, maaari makapag-observe tayo ng mga spherules, tas nasa loob merong mga endospores. So in this photo, yun yung nakikita natin na spherical shaped cells with kind of like other structures on the inside. So again, that's the yeast form of coccidioides immitis. Alright, so this illustration right here just shows us the life cycle of how coccidioidomycosis would occur for a person who has inhaled the arthroconidia. Let's proceed to the next causative agent of systemic mycosis. Next is Histoplasma capsulatum. So Histoplasma capsulatum is the causative agent of histoplasmosis. And of course, this one is also acquired via the inhalation of its microconidia. Okay, pag na-inhale daw po yung microconidia, doon magsisimula yung infection. Now, these microconidia are phagocytized by the macrophages within the pulmonary parenchyma. Okay, so di ba meron daw merong mga macrophages within our lungs, within our yung pulmonary parenchyma. Now, eventually, heavy exposure would lead to mild pulmonary disease. Okay, so dito po, no, hindi ganun ka-virulent ang Histoplasma capsulatum. Kailangan mo pa ng heavy exposure, kailangan marami ka munang ma-inhale. Tapos pagkatapos nun, mild lang din yung pulmonary disease na ma-experience nung pasyente. Alright? So, for immunocompromised persons, no, Histoplasma capsulatum could cause a progressive and fatal disseminated disease. Okay, so that happens, no, and that is referred to as a chronic pulmonary histoplasmosis. Mas malala po ito for patients with COPD. All right. Now, listed here are sources of Histoplasma capsulatum. As you can see right here, bird droppings or bat guano. So bat guano is also could also be used as a material, no, that could be made as a fertilizer, as we can see right here in this example. So in its raw form, maaari daw na nagko-contain ito ng mga microconidia ng Histoplasma capsulatum. Let's look at the microscopic morphology of Histoplasma capsulatum. First up is the mold form. So the mold form of Histoplasma capsulatum are seen as large, round, and echinolate. No? Large, round, echinolate macroconidia, as we can see right here. Ulitin natin, kapag sinabi nating echinolate or tuberculate, ang ibig sabihin nun is that they have rough or spiky projections on their surface. Diba? If you remember our discussion on cutaneous fungal infections, ginamit din natin yung description na echinolate for Microsporum canis, and Nanidsea gypsea. Di ba po? Meron din silang rough or spiky projections on the surface of their cell. So, ulitin natin, that's what we mean when we say echinolate or tuberculate. Okay? One of my former students, no, said that this photo right here looks like it's a virus particle, 'di ba? Nung nagkaroon ng pandemic, medyo nauso yung mga illustrations of viruses, and this kind of looks like one of those virus particles. So, yun, naalala ko lang po yung description na yun. Next, let's look at its yeast form. Okay, so its yeast form has been described as small, oval, and encapsulated. And these ones are found within monocytes or macrophages. Okay? Now, quote-unquote, encapsulated kasi hindi naman talaga tunay na encapsulated ang yeast cells ng Histoplasma capsulatum, no? Let's look at this this is this photo with description right here. They appear to be encapsulated due to staining. Okay, so kumbaga parang artifact lang siya through the staining process. Okay, so if for example we take tissue samples or patient samples, no, wala naman talagang capsule yung Histoplasma capsulatum, okay? Contrary to its name. Ang nangyayari lang, nagmumukha lang daw siyang encapsulated kasi after going through the process of staining, yung spreading the sample, fixation, drying, and actually applying the stains and all those other steps, no? Ang nangyayari is nag-shrink yung yeast cells ng Histoplasma capsulatum. So, may iwan na space sa paligid ng cell. Kaya nagmumukha siyang encapsulated kahit hindi naman talaga. Alright? So here's a better photo. If, for example, this is the monocyte or macrophage of the patient, this one, inside of the orange circle, yung mga nakikita nating bilog-bilog na dark blue or parang almost purple na, may nakikita tayo. Tapos, may mga clear or unstained areas, di ba, sa paligid nila. Those are the artifactual capsules. So, structurally, wala naman talagang capsules ang Histoplasma capsulatum. No? Ito po ay due to artifactual, kumbaga artifactual shrinkage lang ng cells. Up next is Paracoccidioides brasiliensis. So as the name implies, this is the causative agent of Paracoccidioidomycosis. Okay, so madali lang naman tandaan yung mismong disease associated, diba? So kapag coccidioides yung causative, it's coccidioidomycosis. Kapag blastomyces yung causative agent, then it's blastomycosis. So, ayun nga po, Paracoccidioides brasiliensis, it's Paracoccidioidomycosis. So, ang nag-iiba-iba lang naman or kailangan nating tandaan dito is yung other names or common terms for the diseases associated. So, as we can see right here, this is otherwise referred to as paracoccidioidal granuloma or the Lutz Splendor Almeida disease or the South American blastomycosis. Okay? So, kanina, recall time, what is the causative agent of the North American blastomycosis? It's blastomyces dermatitis, diba? So, minsan, no, for people who are learning this for the first time, medyo nakakalito, medyo nako-confuse sila, no? Nako-confuse sila kung paano nila ma-distinguish or paano nila matatandaan yung kung alin yung North American and kung alin yung South American. Now, for me, no, for me, this is a very non-scientific way of remembering kung which is which, alright? But let's try to think, no? If we were to take a map or a compass, nasaan yung north? Nasa taas, diba? Now, if we were to go through the alphabetical order, nasaan yung letter B for blastomyces? Nasa bandang umpisa or nasa bandang itaas din po nung alphabetical order, diba? So, North American blastomycosis, no? It's blastomyces dermatitis. Nasa taas siya kasi nasa north. Now, using the same kind of like idea, kapag sinabi nating south, nasaan yung south sa mga maps or compass? Nasa baba. diba? Now, if we were also to go through the alphabetical order, nasa na banda yung letter P for Paracoccidioides brasiliensis? Nasa ibaba din, 'di ba? So, South American blastomycosis is caused by Paracoccidioides brasiliensis. Nandun sila sa ibaba. All right? So, it's very it's really a non-scientific way of remembering, but it helped me. Okay? So, if you have better ways to remember or to distinguish kung alin yung North American blastomycosis and South American blastomycosis, that's up to you. Pero yun po, ganun ko natandaan, no? Yung placement nila sa compass or map and also yung arrangement nila in alphabetical order. So, North is letter B or blastomyces dermatitis. South is letter P or Paracoccidioides brasiliensis. Alright? Again, if you have better ways to remember that, that's up to you. Okay? So, ayun po. Let's look at some of the clinical manifestations. Again, if the patient is an immunocompetent person, then this could just lead to asymptomatic infections. Pero ayun po, no, for some people, this may develop into ulcerative granulomatous lesions. Okay, ulcerative granulomatous lesions. These lesions may be observed more commonly sa buccal cavity or buccal mucosa, so at the mouth, at the nasal mucosa, no? So sa nasal cavity, and at the gastrointestinal mucosa, no? So within our intestines. Doon daw po pwedeng mag-form yung mga lesions, no, ng Paracoccidioides brasiliensis infection. Alright, now let's look at its microscopic appearance. Okay, first up, it has a mold form. Now, the mold form of Paracoccidioides brasiliensis is indistinguishable from blastomyces dermatitis. So, oval or globose din yung shape ng bawat conidia, tapos very short din yung conidiophores. So, hindi natin ma-differentiate basta-basta yung mold form ng Paracoccidioides brasiliensis and blastomyces dermatitis. Nandito po sa yeast form yung special description na. Nasa yeast form yung difference nila. Now, the yeast form of Paracoccidioides brasiliensis has been described to be multipolar and narrow-based. Okay? So, kapag sinabi nating multipolar, magkakaibang directions pwedeng mag-grow yung daughter cells nung Paracoccidioides. And kapag sinabi nating narrow-based, as we can see right here, very thin, napakanipis nung point of attachment nung bawat daughter cell dun sa mother cell. Okay, so if you would remember, no, madi-differentiate natin or very opposite yung description ng blastomyces dermatitis versus Paracoccidioides brasiliensis. Kapag blastomyces dermatitis, broad-based yung budding, malapad yung point of attachment, and also unipolar. So, isang direction lang or isang lugar lang kung saan pwedeng mag-grow yung daughter cell. Kabaliktaran ng Paracoccidioides brasiliensis, multipolar, meaning magkakaiba kung saan-saan pwedeng mag-grow yung daughter cells. And narrow-based, meaning ang nipis lang, no? Very thin point of attachment for Paracoccidioides brasiliensis, yung mga daughter cells niya. Now, this appearance has been described as either the Mickey Mouse cap or the mariner's wheel or the ship's wheel, as you can see right here in these photos. Let's proceed to the next one, which is Thalaromyces marnifae. All right. Now, Thalaromyces marnifae, this was formerly referred to as Penicillium marnifae. Now, Thalaromyces marnifae kind of stands out in comparison to the other members of its genus because within its genus, this is the only dimorphic Thalaromyces. Okay, ulitin natin, lahat ng ibang members ng genus na Thalaromyces, they are not dimorphic. It's only Thalaromyces marnifae that is dimorphic. And aside from that, it's only Thalaromyces marnifae that is clinically significant. No, it's only Thalaromyces marnifae that is pathogenic for humans. Everybody else that is under the genus Thalaromyces is non-pathogenic, not clinically significant for humans. Okay, so again, Thalaromyces marnifae was formerly referred to as Penicillium marnifae. Now, endemic to Southeast Asia, and this is usually just associated with opportunistic infections. All right, let's compare that to Coccidioides immitis. Alright? So, Coccidioides immitis, kahit immunocompetent ka, kahit wala kang comorbidity, kahit di ka immunocompromised, that could cause an infection. But for this one, infections only happen if the person is immunocompromised, hence being labeled as an opportunistic pathogen or opportunistic causative agent of systemic mycosis, specifically, or more commonly among AIDS patient, all right? So people with HIV infections. And with this one, we may also be able to observe cutaneous lesions, all right? Now, its mold form has been described to have a green aerial hyphae, but a reddish-brown vegetative hyphae. So on the surface, it appears green, but on the reverse side or the underside of the plate, we may see that the vegetative hyphae is reddish-brown. Okay. Now, other descriptions would include the yeast form now. Since dimorphic nga siya, kaya niya ring mag-produce ng yeast form. But again, the yeast form is not very distinguishable in terms of appearance because it greatly resembles that of Histoplasma capsulatum. Magkahawig daw po yung yeast form ng Thalaromyces marnifae and ng Histoplasma capsulatum. Here are the references that were used in the making of this discussion. And that's it for our week 4 discussion. As usual, if you have any questions or clarifications, just send them through our Teams chat. This has been Aurel Enriquez. Thank you so much for watching.